because they came through quite quickly. A few people, what they're saying. So we do question number 1, which was on the government website. It states COVID-19 is no longer HCID, high consequence infectious disease. I asked why. I did help you out and said it was an IPC, infection prevention and control now. But did you get any more information from your contacts?
Yeah, I believe it's the information I got on this one is that, like a lot of things in government, the language that is used around certain things isn't necessarily always as obvious or as common sense as it could be. And this is the HCID definition is a very, very technical medical one. And the reason, as I've been briefed, is that statistically, because of the relatively low mortality rate from COVID-19 compared to other
I was going to say 18,100 people is
but
1 in 5
statistically,
they were saying, wouldn't they? So,
wait, no, it's not as high as that.
no, but that's what they're kind of saying it would be, or infected by it 1 in 5. That's what they're saying at the start.
Yeah, it hasn't panned out to be anything like that. We're more in the 1-2% marker. Now, as I said a minute ago, every single one of those lives lost is tragic. Unfortunately, the way the language and the technical definitions of these things work, that is why on this website it is classed as something else. I think the important thing to do here is not to get too hung up around these technical definitions and get on with the job of supporting the NHS, getting them everything they need to fight this. We have got capacity in every part of the United Kingdom within the NHS to take patients in. Anyone that needs a ventilator, there is a ventilator there for them. And likewise, getting on with the Herculean effort of getting things like the PPE out. 1 billion items of PPE have been delivered so far. Is that enough? Well, of course, you've got to keep going. I was talking to the chief executive of my local healthcare trust, the Buckinghamshire Healthcare Trust, earlier, and actually the rate at which hospitals go through PPE is in the thousands a day. And so the ability to keep the hospitals stocked is always going to be one of replenishing stock on a very frequent basis. Rather than individual hospitals carrying months worth at any one time, because of the sheer volume of PPE, of gowns, of gloves, of masks, of visors that anyone that needs them in a clinical environment gets through. And that's why the army has been brought in to manage that logistics exercise. And I think that's where we've got to focus our effort rather than on some of these cumbersome definitions.
It is, but when people look at that and say, it's not a high infection, it's a bit like, well, yeah, I mean, I understand what you're saying, but yeah, well, hopefully that'll explain to a few people out there. I mean, it does say, infection prevention and control, so it's kind of along the same lines. It's a bit like, we know it's to something out there, but HCID clearly points out, this is highly contagious, and we need to do everything we can to limit where infection prevention is a bit...
Yeah, as I say, the language in so many parts of the public sector can often be very, very cumbersome. And, of course, we all know coronavirus is highly contagious. That's why we're all staying at home. Within this particular definition, though, it doesn't meet that certain criteria. No, it's not saying it's not highly contagious, it's saying it doesn't meet that very technical definition.
Of a high mortality. So, right, okay.
Yeah.
Okay, I'm happy with that. I thought that's what you'd come back with, personally. It's just, it's nice to hear it from somebody who has the necessary contacts to give us the right information.